Hi, I am Linda. In this video I shall explore what is psoriatic arthritis, the symptoms, diagnosis, causes, the early stages, the risk factors, and much more. There are 100 different types of arthritis, and psoriatic arthritis is one type. It causes swollen, stiff, and painful joints that attacks your knees, ankles, as well as your hands and feet, but it can differ from person to person. You could also have inflammation in your spine, ligaments, and tendons that connects to your bones. Usually in the Achilles heel called enthesitis and nail turmoil or lesions. Your fingers can also become swollen called sausage fingers. The progression of these symptoms is slow and over a long period of time. If the symptoms do not get treated, the joints may become permanently damaged and deformed, and you may have to have surgery. In the early stages, it could be confused with other conditions, such as the ligaments and tendons could be causing pain, as in tennis elbow, where you are using the same joints consistently. Another condition could be dactylitis, where the infection is in your finger called sausage fingers. The symptoms are like psoriatic arthritis. If you think you have, or are developing psoriatic arthritis, and have the following signs of symptoms, it may help you to get a diagnosis early, before complications set in. If you have any of the following, you should see your doctor immediately, as they can send you to the specialist who deals with arthritis. Number 1. You may have pain and stiffness in the joints. All types of arthritis cause inflammation of the joints, which develops into pain, tenderness, and stiffness. With psoriatic arthritis, you may develop it in many joints. The pain could be in your large and small joints, such as your weight-bearing joints, like your hips or knees, or you small joints like your fingers or toes. Number 2 is joints. Your joints can become swollen and warm to the touch. Your joints are surrounded by tissue that cushions your bones on each side of the joints to protect the bones when you move. When you get this swelling, the fluid collects in the tissue and produces heat and causes the inflammation and pain. In severe cases, the joints can become misshaped. Number 3 is your nails. Your finger and toenails can become discolored, pitting, or sometimes have holes and look like fungus infection. The changes in your nails are a prognosis that you may have joint disease, an arthritis known as nail psoriasis. It is more likely to develop this when you are over 40. Number 4 is the separation of your nails. When your nails separate or even drop off, this is called onycholysis. When your nails first peel off, the nail will become yellow, greenish, purple, white, or gray. When your nails start to come away, it is best if you cut off the affected area as the new nail grows. They can also become soft. Number 5. You may have pain in the lower back. This is called spondylitis, where it is swelling and pain of the spine. The areas most likely to be attacked are your lumbar region. And the muscles can become weak and painful. As it is the lumbar region that can become painful, it can also attack your hip, especially if you sit for a long time. If nothing is done for a while, your pelvis region may fuse together and you will feel fatigue all the time. Number 6 is inflamed eyes. When you develop psoriatic arthritis, you could develop eye problems, such as red and itchy, or dry, blurred vision, or you could get sensitive and pain to light. This is called iritis. Or you could see what is called floaters. If this happens, you must see your opticians before you get damage in your optic nerve, or cataracts. Number 7 is developing psoriasis on your scalp, which can be itchy and has a rash. This rash, or psoriasis plaque on the skin, can also develop on the elbows, knees, and around the ears. Number 8, painful feet, is another early symptom that could travel to your ankles. The pain can be coming from the tendons that are attached to your bones. This is known as enthesopathy. Number 9 is a reduction in movement. You could have difficulty doing simple things like reaching your arm out to grab an item, washing up, or doing the housework. You will also feel it difficult to bend your knees or lean forward. If your job is typing, you may have difficulty to use the keyboard or mouse when it develops in your fingers. When the condition starts to worsen, you may not be able to move your joints beyond a certain point. This is called contracture deformity. It can also lead to your hands or wrists having thick layers of tissue under the skin. And 10 is fatigue. You may feel that you need to sleep throughout the day. Fatigue could be caused by inflammation and pain 24/7. You could have low or no energy, low appetite, anxiety, and depression. Other symptoms could be acne, or rapid mood swings, or irritable and short-tempered. Your skin becomes thin and easy to bruise, and muscle weakness, and wounds may take a long time to heal. There are several high-risk factors of developing psoriatic arthritis, such as if you have psoriasis, you could be at a significant high risk of developing psoriatic arthritis. The first risk factor is if your parents or sibling has psoriatic arthritis, as it develops in the genes. Second is that it can attack at any age, from children to adults, but commonly it develops in adults between 30 and 55. Number 3 is that you may be at high risk of developing conditions like cardiovascular disease and hypertension, metabolic syndrome, or diabetes. Number 4, if you are a smoker, you must stop. Also, if you drink alcohol, you should limit your intake, or if you have had a physical trauma. The treatment for psoriatic arthritis is to slow the progression and reduce the symptoms, which can overall improve your quality of life. If your doctor has diagnosed you with this disease, they may prescribe to you some medication, like disease-modifying anti-rheumatic drugs. But with all medication there are side effects. With these ones you could develop loss of appetite, nausea, diarrhea, or abdominal pain. Or your doctor may give you non-steroidal anti-inflammatory drugs, which can help you with the pain and inflammation. These could be ibuprofen or diclofenac. With my osteoarthritis, the doctor has prescribed to me a clear gel called Fenbid, which is in the ibuprofen family, which I rub on the main areas at night and in the morning. Also, your doctor may give you corticosteroids that could help you to reduce the pain and swelling of the joints. But you may be allergic to corticosteroids. In this case, they may give you biologic therapy. The biologic therapy stops the chemicals in your blood from attacking the joint lining of your body. But with everything, there are side effects, and the therapy may have a reaction around the injection site. You may have to keep up with regular blood tests, as there could be more serious side effects causing liver and kidney blood count problems. Also, you could have more severe reactions like a sore throat, high temperature, or diarrhea. If this happens, you should see your doctor straight away. Other things that you can do to relieve the symptoms could be having gadgets to help you around the house. Like with cooking, you may feel it best to get a two-handled saucepan. There are plenty of gadgets in your local disability shop. Or you could get bath or shower rails, or around the toilet. If you work at a desk, you should ask for a proper support chair that will help with your backaches. If you have or have been diagnosed with psoriatic arthritis, it may affect your skin and joints that can become swollen, stiff, and painful. As the disease is incurable, all you can do is to slow down the symptoms, as it can damage your joints, making them permanently deformed. When you are diagnosed with psoriatic arthritis, your doctor will send you to a rheumatologist, who will give you an X-ray. This will show them how far the disease has gone to your joints. Also, blood tests may be done to check for inflammation present in specific antibodies. When they have assessed you, they then can find out which drugs will help to reduce pain and inflammation. I am not a medical professional, and this video is for information only. If you have any worries, you should see your doctor. Thanks for watching this video. If you have found this helpful, then click the subscribe button to follow my channel and click the bell. If you have any questions about arthritis, then just leave a comment below. I hope this has helped you, and good luck.